Good day, everyone. My name is Mr. Chisum. So today we'll be looking at the dissection of the spleen. We'll be looking at the dissection of the spleen. So this small organ that I'm holding is the spleen. This is the spleen. The spleen is defined as an ovoid, purplish, lymphoid or lymphatic organ that is situated in the left hypochondriac region of the abdomen or in the left upper quadrant of the abdomen. The spleen, being a lymphatic organ, is the largest lymphatic organ in the body. And you know what lymphatic system do? They are involved in immune response of the body or defense mechanism of the body. So this organ is the spleen. So we'll be looking at the size and weight of the spleen. So the spleen is 1 inch in thickness, or it is 2.5 cm thick. Then coming to the width or the wideness, it is 3 inch wide or 7.5 cm wide. Then the spleen is 5 inch in length or 12.5 cm long. So this is the size of the spleen. Then the spleen weighs 7 ounces. So we'll be looking at the location of the spleen. Talking about the location of the spleen, I told us that the spleen is situated in the left hypochondriac region of the abdomen. Some part of the spleen extends into the epigastrium. So that is it. So let's look at the position of the spleen in the body. So this is the exact position of the spleen. This is the exact position of the spleen. This part lie in the left hypochondrium, while this part extends into the epigastrium. So this is the exact position of the spleen. So let's look at the functions of the spleen. Like I told us, the spleen is the largest lymphatic organ in the body. So you should know that the lymphatic system is responsible for the immune response of the body and also the defense mechanism of the body. So the spleen is actively involved in the immune response of the body. Then the spleen also helps in the proliferation of white blood cells. You know that the white blood cells are involved in the immune response of the body. So the white blood cells proliferate in the spleen in order to respond. Then also prenatally, it serves as a hematopoietic organ, which is responsible for the production of blood in the fetal life. Having seen that, the spleen also helps in the storage of red blood cells, and also it helps to identify, remove and destroy old red blood cells or weak red blood cells. So you can see these are the functions of the spleen. Irrespective of all these functions of the spleen is not a vital organ. In essence, the spleen is not required to sustain life. So that is why it is not a vital organ. So if some part of the spleen or the spleen is removed entirely, life continues because it is not a vital organ. It is not needed to sustain life. So let's go over to the external features of the spleen. The spleen has 2 surfaces, 3 borders, 2 ends, and 2 angles. It has 2 surfaces, 3 borders, 2 ends, and 2 angles. So let's go over to the surface of the spleen. This is known as the diaphragmatic surface because this surface is the surface that is related to the diaphragm. So this surface is attached to the diaphragm. That's why it is called the diaphragmatic surface. Then we have the visceral surface. The reason why this roughened surface is called visceral surface is because it is related to the visceral organs. Let's go over to the border. It has three borders. The first border of the spleen is this superior border here. This is the superior border of the spleen. Then we have the inferior border of the spleen. So this is the superior border of the spleen, while this is the inferior border of the spleen. Then we have the intermediate border. The intermediate border lie in the visceral surface. So you can see the intermediate border of the spleen. So this is the intermediate border of the spleen. So let's look at the two ends of the spleen. This end is the lateral end, while this end is the medial end of the spleen. This is the lateral end, or you can also call it the anterior end. The lateral end or the anterior end. The medial end or the posterior end of the spleen. So these are the two ends of the spleen. Then coming over to the angles in the spleen, towards the lateral end of the spleen, you see this angle. It is known as the anterobasal angle. So this is known as the anterobasal angle of the spleen. Then when you come towards the inferior border, you see another angle here. This is known as the posterobasal angle of the spleen. So we've been able to see the external features of the spleen. Let's go over to the impressions in the spleen. The impressions in the spleen, or the relations or organs that are related to the spleen. So looking at the spleen now, this part is related to the greater curvature of the stomach. So this is known as the gastric impression of the spleen. So it is related to the greater curvature of the stomach. So this is the gastric impression of the spleen. Then having seen the gastric impression, this area is known as the renal impression of the spleen, because this area is related to the left kidney and also the left suprarenal gland. So this is known as the renal impression of the spleen. Then this part is known as the colic impression of the spleen, because it is related to the left colic flexure or the splenic flexure. That is where the name splenic flexure came from. So this part is related to the left colic flexure. Then we have the pancreatic impression. This is the pancreatic impression, because this part is related to the tail of the pancreas. So this is the pancreatic impression. Then having seen these impressions in the spleen, let's see the ligaments in the spleen. In the gastric impression, you see these ligaments here. This ligament here is known as the gastrosplenic ligament. So this ligament, gastrosplenic ligament, it kind of separates the spleen from the stomach. Then we have another ligament towards here. It's not so visible, it's cut off, but this ligament here is known as the splenorenal ligament, which is related to the left kidney. So this is the splenorenal ligament. Then we have another ligament here. This ligament here is the ligament that connects the tail of the pancreas to the spleen, and it is known as glenoligament. So this is the ligament. So we've seen these three ligaments in the spleen. Then let's go over to the hilum of the spleen. Towards this visceral surface, at the level of the intermediate border, you see this part of the spleen. It is known as the hilum of the spleen. The hilum of the spleen is the part of the spleen or the area of the spleen that the vessels and nerves enters the spleen. So this is the hilum. So you can see the splenic artery and vein entering the hilum of the spleen. So this is the splenic artery. The artery that I'm holding is the splenic artery, while this is the splenic vein entering the spleen. So the both of them are the splenic artery and vein. So here is the hilum. So let's go over to the clinicals. We have a clinical condition known as splenomegaly. So splenomegaly is an enlargement of the spleen. You can see the size of the spleen. You can see the size of the spleen. But in the case of splenomegaly, the spleen becomes so large. In the position that the spleen is lying, you cannot palpate the spleen. But once the spleen is large, very large, in the case of splenomegaly, you notice that a doctor can be able to palpate or touch the spleen because of the excess size of the spleen. Then we have another condition known as spleenectomy. Like I told us, the spleen is not a vital organ, so it can be removed. So it is not necessary to sustain life, irrespective of its numerous functions. So splenectomy is the surgical removal of the spleen, some part of the spleen or the whole spleen in total. And situations or conditions like splenomegaly can lead to splenectomy. Then also disease conditions affecting the spleen can also lead to splenectomy. So let me kind of do a recap of what I said. I said that the spleen is an ovoid lymphatic purplish organ that is situated in the left hypochondriac region of the abdomen. And I told us that the spleen is 1 inch thick, 3 inch in the width, 5 inch in length. Then the spleen lies in the left hypochondriac region, while some part of it extends into the epigastrum. The spleen is situated at the level of the 9th to 11th rib. So at the level of the 9th to 11th rib, that is the situation of the spleen. The functions of the spleen includes the immune response of the body, defense mechanism of the body, storage of red blood cells, proliferation of white blood cells, and also prenatally helping in production of blood. So coming over to the surfaces, this is the diaphragmatic surface, this is the visceral surface, then the border, the superior border, the inferior border, the intermediate border, then the medial end or posterior end, the lateral end or anterior end. Then we have the anterobasal angle and the posterobasal angle. Then this is the hilum of the spleen that allows the vessels and the nerves that enters the spleen. This is it. Then we have the gastric impression, the renal impression, the colic impression, the pancreatic impression. Then we have the gastrosplenic ligaments, we have the splenorenal ligaments, and we have the ligaments. So we've come to the end of this teaching. I'll encourage us to subscribe to my YouTube channel, Learn with Chisom Great. Like this video, share this video to your friends, and comment on this video. Thank you very much.